Uh, of course, there is. Athletes are individuals, young people who undertake strenuous physical activity that challenges them physically, challenges all their systems, including their heart. And because of that, and for them to perform well, they have to be healthy, they have to be very fit, they have to be at their peak. So it's important to ensure that it's safe for them to participate in these strenuous physical exercises, and also that they are capable of adapting to training in order for them to excel. So we do this for these reasons, to ensure that they are healthy, they are fit, and it's safe. Because for many of the elite athletes, it's not only about playing or competing, it's about competing and winning. The difference between winning and losing is small now. So fitness is an issue. And you can't be fit, you can't achieve that level of fitness if you have any medical issue.
So this...
For every other person, like Dr. Babatunde mentioned, it's important to be conscious of our health. We are human beings, we can fall sick, we can have medical conditions. So it's advisable that at least when you attain an age of 40 and above, every year you undergo some medical assessment or medical evaluation
But
to
this
determine how healthy you are and whether you have any medical condition that can be treated. But more importantly, the message should be that as Nigerians, we are beginning to witness increased frequency of heart attack or cardiac arrest, which, as you know, has not been common over the years. So we need to focus more and speak to ourselves to do those things that we need to do as institutions, as professionals, to address some of these issues, and there are many.
Well, since you say that this hypertrophic cardiomyopathy that is difficult to predict and is common with blacks and Caucasians, is it also within a certain age group from what you've noticed?
Yes, it's not difficult to predict because it could be identified when you investigate the athletes. If you do an ECG, you can suspect if an athlete has hypertrophic cardiomyopathy. If you do an echocardiogram, you can actually diagnose that. So it's not difficult to predict. What is difficult to predict is if you don't do anything and then the athlete is apparently very healthy and he can die suddenly. And yes, it affects it affects everybody, but it manifests more under strenuous physical activity. So there are many people who walk around with hypertrophic cardiomyopathy, but because the heart is not challenged, maybe they don't die suddenly as frequently as those who are physically challenged in exercise. It's commoner in blacks. It manifests more when you challenge the heart doing a lot of exercise. That is why if you go to your doctor and you are 45 and you want to start physical activity, he will advise you to go and have a check to see that you are normal, that you don't have any heart problem.
So, but now that we have these two unfortunate cases with us, is the NFF looking to do things differently or just go back and double check and ask, could we have missed anything? Do we need to improve on anything? Are you taking that kind of inventory?
Yes, we are. As Nigerians, as professionals, it's important to draw a lesson from events of this nature. Just last week, because we're in the process of preparing for Olympic Games, we spoke to ourselves maybe to pay greater attention to our coaches and officials. In the last 4 years, we have grappled with the issues of officials having to deal with a lot of health challenges. So yes, I think as chairman of the medical committee of the Nigerian Football Federation, we will have a greater look whether we are doing enough, not only to ensure that we know the health status of coaches. And when I speak of coaches, I do not only mean national coaches. There are many more coaches who are involved with football at various levels. We have done that for referees because we had recorded quite significant incidences of sudden death among referees because of what they do in the process of officiating. And we have succeeded in reducing that. So it's important that we look at that and see what we can do more to monitor the health of our coaches.
And again, perhaps you should tell us what form of disease or illness or some kind of injury are we likely to see in our sportsmen and women?
Many injuries. Sports generally is associated with injuries. Some sports are more at risk of injuries than others. So you see mostly musculoskeletal injuries, whether acute or chronic, or overuse. But that has not been of significant concern to us because it doesn't threaten life. And we have, at the national level, developed very impressive capacity to provide medical support to athletes, at least to ensure that we're able to manage injuries, we're able to rehabilitate injuries, and that our athletes are able to come back as quickly as possible to participation and to compete for the country. We haven't yet achieved that much with our very young athletes playing at the lower level. And that should be of concern to everybody, that we should strive to ensure that every athlete playing sport at whatever level have access to some basic form of medical support. We are working hard in football. We are doing something with the state sports councils in that respect. So then you also have to invest some form of medical support to our children who are playing sport in school. Because if we encourage our young kids to participate in physical activity for all the benefits that we know, and we're not able to provide some basic support to them when they get injured, and they can get injured, then that may be a disincentive. We're also promoting physical activity among our populace, middle and age people. And they can fall, they can get injured, they can have sprains, they can have strains. So there has to be a conscious effort to encourage our colleagues who may not necessarily be specialists in sport medicine to take interest in sports first aid, so that everybody, not only doctors or nurses, people are able to know that if you have a very simple, mild sport injury, that it can be treated by a parent, by a teacher, by a coach.
So what are those challenges, those needs that you would love to see that the government and perhaps the Minister of Health fill in for you?
The basic challenge affecting our specialty is lack of capacity, lack of training in the country. There is no university in Nigeria that offers postgraduate training in sport medicine. We all had to go out specialize in sport medicine. And with the prevailing economic circumstances, it's becoming increasingly more difficult to send doctors out to train in sport medicine. So we probably need to do something to see that maybe we develop our capacity to train. We're a country of 170 million. We have less than 15 sport physicians in the country. That is appalling. Then more importantly, to realize that it's not possible for all those who are engaged in physical activity to have access to doctors. So we have to identify other people at the lower level of care, nurses, first aiders, to be able to provide some basic medical support, some basic sports first aid. Thankfully, many of the injuries athletes sustain are mild, and they can easily be treated by people who are not even doctors.
Well, and much as the NFF, the LMC, different groups associated with sports and football in this country are trying to do what they can to ensure that standards are upheld. What kind of scenario do we have, or what does the NFF do, particularly given the economic situation, to clubs insisting that the doctors are paid, they have the basic or the minimum requirements for their clubs health-wise now? What are you doing in that respect?
Again, a major challenge. 5 years ago, the NFF and the league management company, or board then, took a decision to review the guidelines regarding the provision of medical support to players, and also to ensure that players have access to insurance. And we tried to follow this very, very, very seriously. It was made part of the requirement for licensing players to play and for accredited stadia for matches. It hasn't worked well because many of the clubs are owned by governments. Many of the states don't have the luxury of so many medical doctors. So practically 70% of the clubs do not have team doctors or team physiotherapists. They rely on other paramedicals for medical support. So we tried to work that out to see if we can encourage clubs to engage doctors on part-time or on retainership. And then we invested in training those that are attached to clubs, whether they are doctors or not, just to be able to enhance their capacity to provide medical support. But the economic situation is making it extremely difficult. We are talking with the league management company to see if they can invest part of their income into subsidized medical care. And they have tried to do that. On one occasion, they distributed standard medical bags to all clubs in the country. In 2014, they acquired and they invested money to buy standard medical bags, emergency medical bags for all the professional clubs in the country. And the NFF is keen to do that for the other levels of the leagues, the Nationwide League and the Women League. So they are doing enough. But the issue is, I think there is need for a national network of medical personnel who are interested in football and in other sports as well, so that we can all come together, form a network and a group, and dedicate ourselves to enhancing and promoting the health of these athletes. Without athletes, there can be no coach, there can be no team doctor or team nurse.
All right, Dr. Abdulkadir Mua'zu, former team physician to the Super Eagles and the chairman, NFF Medical Committee. Thank you for talking to us today. Well, we'll be back.
Thank you very much. It was my pleasure.
All right, then. We'll be back after the break. Join us again.